The all right, just a second. All right, I don't have the agenda in front of me, but I'm about 30 seconds away. So let's go ahead and I'll do it from memory. So, okay, the appointed hour, 1:30 has arrived. So we'll call the meeting to order. And we don't generally do a roll call for the finance meeting. So we'll just go into, I believe public comment would be the first order of business. Okay.
I would say that louder. Gary, I'm not seeing anyone on.
Okay. Hang on.
There's no.
I'm like five steps away. Give me 5 seconds to get in the door, please. All right. So do we have to address here? All right. We do have the minutes in hand of our July 12th meeting of 2023. Yes, for a motion on that.
Move to approve the minutes of July 12, 2023.
I second.
Okay, it's moved in second. If there's no further questions, all in favor, indicate by saying aye.
Aye.
Motion carries. Okay, very good. Brings us to our topics of discussion today. We have 3 items. Our first item is discussion regarding the nursing home proceeds / needs exploratory committee final report and recommendations. We have Mr. Clark.
Great, thank you. Commissioner Eichelberger, Commissioner Fauci, Commissioner DiFilippo, sorry. My name is Lawrence Clark. I had the honor of being the chairman for the Nursing Home Proceeds Needs Exploratory Committee. So we have a presentation today for you on that report that we submitted almost 3 weeks ago. I would like to ask first, in terms of format, on questions, do you prefer to ask while the presentation is going on or at the end? I just want to know if there's a preference.
What's your preference?
Doesn't matter. My wife says I can talk and talk and talk. So if you want to interrupt.
That was your first question.
Yeah.
Let's play by ear.
Okay. Thank you.
Mr. Clark, could I ask something though? Could we get the names of everybody here on this?
Sure. I was going to
with the exception
slide,
of
but,
Hunter.
Go ahead.
Okay. There's a slide. Let me.
Okay, that's fine.
Is it the other arrow or down?
Yeah.
What arrow?
Arrows.
Okay. Nothing's happening.
Help. It's my turn.
It's for lock.
Yes.
Oh, there we go. Okay. So in terms of the agenda, we have the list of the committee members, committee mandate and actions, the subcommittee reports, which you'll hear individually, public survey analysis, proposed endowment fund discussion, and then our conclusion. So the first slide is the actual committee members. There was myself. There were 2 that resigned during the process, and they're noted here by an asterisk. We have Luke Conser here, Barry Denk, and Joseph Gottwald, who is not with us, Ruth Hauer, Gene Kuntz, who's here, Dr. Corey Myers, who's not here, Randy Nolan.
I was the vice chair.
And also Barry was the secretary. Rick Ravegno, I hope I said that right. No, okay. It's,
At least you're consistent.
it's the Irish. Anyway, and Jennifer Swan. So, and each one of them will be presenting different points throughout the presentation.
Okay.
So a little bit of background, the mandate that we had when we started was to research human service needs countywide and determine if the county receives funding for those needs. And I have to stress this, and I know we say it throughout the slide, but the county employees for the different areas were very, very helpful and helped us a lot in coming to a lot of the proposals we have here. So they did a very admirable job in helping us with this process and project. We then held meetings both at the committee level and the subcommittee level to do research to gather opinions of residents of the county regarding the use of the proceeds were designated. We work closely with members again of the Human Services Policy Team Steering Committee. And finally, we prepared a recommendation for the Board of Commissioners to include what type of fund should be established and what level of funding is required for that fund. In terms of subcommittees, there were 4. Each of us was assigned to one of the 4 subcommittees. Again, we did research on those topics, and then we reported back to the committee. The 4 subcommittees were the Mental Health Subcommittee. We have Lou Conser and Gene Kuntz here, and Rick from that committee. We have Drug and Alcohol, Intellectual and Development Disability Subcommittee. Barry Dent is here to talk about that. The Older Adult Nursing Home Needs Subcommittee, which is myself and Randy Nolan, who will talk about that committee findings. And the Juvenile Needs Subcommittee, which Jennifer Swan is here to talk about the findings of that subcommittee. And then again, we listed each of the specific county employees who helped us in those specific subcommittee and the issues in those areas. Overall, the committee did look at trying to get as much participation of the public as possible. We approved a public survey tool that was advertised and open on the county's website on April 28th. It was remained open until May 19th. We received a little over 400 responses. And out of the 400, we received about 187 actual comments. So it was very productive in terms of a tool to help us. The committee also held a public forum on May 3rd between 6 and 7:30 at the Carlisle Fire and Rescue Services. Unfortunately, this is not well attended. I think we had 1 or 2 from the public. Again, but what we did notice, which was also in the report, at the same time we were having the advertisement for that meeting, the responses on the web to that survey went up dramatically. So the public was more interested in not attending, but actually responding to the survey. All committee and subcommittee meetings were subject to the Sunshine Law, and were open to the public, both in person and by Zoom. The minute of each committee and subcommittee meeting, after approval, were submitted to the Commissioner's office. So I'm going to turn now to Gene Kuntz to talk about the Mental Health Subcommittee. Just give me a nod when I need to get to the next slide.
Okay. Good. Thank you. And certainly want to thank Annie and Stacy for their help with us. Program issues we found, I'm not sure this is news to any of us. It's been in the news on a statewide national basis, but increasing program needs due to population growth in the county. Certainly COVID hasn't helped, aging of our population, social pressures, really increasing the needs. And that comes with flat state funding. So, which is resulting in an increasing structural deficit for this program. So we did talk about that, and we also identified some modest but high impact needs that could be addressed through some additional funding, possibly off program. And that's with particularly with institutional transitioning from say prison to out of prison or out of other housing to open up needs. And to do that, things like the first month's rent or security deposits, a card down payment to get to that first job. So those type of things are really a need right now, and it's difficult to find funding. So in general, our recommendations, and you'll see these, repeated in some of the other ones. So what we said was that after our deliberations we recommended establishing an endowment type fund that would hopefully allow supplementation from donations from the public or from other funding sources. It should absolutely remain under the supervision of the county officials, elected officials. And we recommended a citizens board to provide input into the use of those funds. And furthermore, for just our work, we think it would be very useful if funds, it shouldn't be supplanted or supplant other funding sources. It should be in addition. But it'd be helpful if they could target some of these high impact areas and be able to be used with a quick and easy application process, because some of these needs are immediate. And then we thought any fund should have an annual report to document its use and the outcomes to measure the effectiveness of its use. So that was our findings. Thank you.
Next, we'll hear drug and alcohol, intellectual and developmental disabilities.
Yes.
Barry, okay.
Good afternoon again, Barry Day. First of all, thank you for the appointment to this committee. It really was a privilege. And I also want to thank Jack Carroll and Sue Carbaugh. They were phenomenal as resource personnel. Something that you're certainly aware of, and I know you've advocated for, but something that they provided to us in the beginning is that there's been a decades-old formula used by the state for funding, and that formula has Cumberland County in the bottom fifth. And as you know, it's the fastest growing county in the state. So I think it behooves all of us who advocate for programs, human services, to keep after the state government, especially our legislative body, to try to change that, because it seems to have fallen on deaf ears over the years. There's been a considerable focus on the opioid crisis, state and national, and as a result of that, there's been sizable funds coming down to support those services with the ERA funds, and now also with the opioid settlement funds. So Jack Carroll reports that funding for program services has been stable and it has been increasing, and that's good. Sue, on the other hand, because of federal and state mandates and their base and waiver funding formulas, and some mandated services with autism, really challenged to provide those services and deal with the waiting list. So it's been a challenge for them over the years, and also specifically talked about the challenges of staff recruitment and staff retention. Burnout because of COVID and long hours, et cetera, it's been taking a toll on staff, and so that's been an issue. So from those discussions, from the information that we gleaned, several opportunities and several issues were identified that we would offer for consideration for use with the Claremont sale proceeds. First of all, a gap in transitional funding, and Jean alluded to this. There are people coming out from transitional situations, whether it's been incarceration, whether it's been inpatient treatment, that type of thing. And as they adjust to life in the community, sometimes there are financial needs, security rent, even clothes for an interview. It's been a challenge for that. And I know there's been a staff volunteer effort over the years with dress down days, et cetera, to raise some funds to underwrite that. But the need is great. And so for gap transitional, even if it's a security deposit or a first month rent payment, those are some needs for individuals in that transitional period that we thought were really important. Staff and provider training. Again, because of retention and burnout, it's been a challenge, especially with provider agencies that are only paid for providing the service. And so getting them into some training, specifically trauma training was talked about for responders and for all types of employees. And we know that training is provided, but maybe looking at some funding that provides some unique ways for that training to occur, and maybe even some incentives for staff to pursue training on their own to better themselves in their positions. Thinking that might be ways to deal with that issue of staff training. And transportation. There is a public transportation system available in the county, but as you know, it is a very rural county. There are outlying areas where transportation at times doesn't conform to the needs of the individuals, especially if they've got parole meetings, if they have to meet with counselors, job interviews, and even given the economic base of this county with a lot of shift work available in warehouses and even in the retail area with some of the stores, transportation for some of those jobs, particularly for single parent households, and tying into that daycare challenges. So those were some of the priority areas that staff, through our work with the subcommittee, have identified for consideration for use of these proceed funds. Thank you.
Okay, next we have older adult nursing home needs. Randy.
Hi, I'm Randy Nolan. I chaired subcommittee, worked with Annie Huff, the AAA. She provided us a lot of information, a lot of background. Subcommittee came up with a number of ideas that we wanted to take a look at. I thank you for the privilege of working on this project, working on a subcommittee. Professionally, I've been working with older adults for 30 plus years. So this was very interesting with my background. We did identify some of the same things that the other subcommittees did. Obviously, there's a need for drug and alcohol services, mental health services across all of our age populations. But when we talk about older adults, there's also service needs for in-home care, home repair, maintenance, food security, housing, transportation, and other potential services as we try to keep people living in the community as long as it's possible and honor their wishes to live into the community. One of the other things that we discussed was the concept of diversion. The concept of diversion is to not allow people to go from hospitals to nursing facilities. In Pennsylvania, nursing facilities are an entitlement under our Medicaid program. So it's easier to get people into nursing facilities. And then you've got the challenge to get them back out into community living. Diversion is trying to put services into place so that there's something in place that they can go straight from the hospital back home while they may be pending the application process for medical assistance to be able to get on one of the waiver programs that we run in the Medicaid program. A lot of times the hospitalization is the catastrophic event that gets the person needing services. They haven't thought before to get on a waiver or to get on Medicaid. So now the hospital says, well, we need to get you out. So I can make a call and get you into a nursing home in 5 minutes. For me to get you in home and community-based services, it could take 4 weeks. So diversion is the concept of putting some services into place for people to go home until they can convert over to other waiver programs. We also talked about, when we talk about mental health services, we talked about the need to increase the number of psychiatrists and other individuals specializing in elder mental health care, dealing with individuals that have dementia, Alzheimer's, a very specialized area. Again, this is something we talked about a lot. I have a passion towards Alzheimer's. I've had many family members, including my brother who has passed from it. I work very closely with the Harrisburg area on their walk with Alzheimer's. So we see a lot of issues with caretakers who need education, who maybe need respite care, who need some services in place to help the caretakers of the individual. Not so much the individual with dementia, but the caretakers who are living the dementia with them. So there was a lot of discussion in regards to services and for those individuals.
Thank you, Randy. The next is the Juvenile Needs Subcommittee, and Jennifer.
The subcommittee ended up being myself and Joe Gottwald. The county staff that we were assisted by was Andy Benner and Nikki McElwee, who were very helpful. They discussed with us the funding, a lot of federal funding that they receive, county funding, state funding that they receive, but did indicate some lapses. For example, if somebody's aging out of the system, money that we help them with, like the down payments on a car or the rent for an apartment, or just even specialized education if they wanted to learn how to be a chef or nursing, just help with some of those items that they wouldn't be covered on with some of the other funding that is already in place. And it's pretty much included with like the additional mental health support and other services for children. That one example that they had given us was like equine therapy or the art therapy for the children that have mental health issues, that type of thing. So that's pretty much good.
Thanks, Jen.
Thank you.
The next, Randy's going to talk about the public survey feedback. Part of the report discusses some of this. It also has the actual survey as an appendix. And I believe it's Appendix A, and Appendix B is some 187 actual comments we received during that survey. So, Randy.
Thank you. Yeah, we wanted to get public input into the process. As we said, the meetings were open. We had very little public input at the meetings or at the public meeting that we scheduled. So the survey was our other tool that we utilized. The staff worked a lot with us to get the survey appropriately questions out, and so they could be put on the website. They monitored the website, did a lot of advertising for the survey. So the survey had 10 program questions and other demographic questions. So there was 10 questions altogether. As we said, it was available on the website from April 28th through May 19th. We advertised it through the county website, through print and broadcast media, local public entities. There was information at libraries and other places about the survey. We received a total of 403 survey responses. Overall majority believe that there are service needs in the mental health, senior aging areas, and children and youth were the major areas that they identified. An overwhelming majority believe that the fund should be placed in an endowment fund and that there should be a citizens advisory group. And actually, the people that said there should have been a citizens advisory group, that percentage was even higher than the people who thought there should be an endowment fund. So everybody thought if we do an endowment fund, you need to have a citizens advisory committee.
How do you explain that there would be a citizen advisory group if there's no endowment?
Well, there were two separate questions. So we asked about the endowment fund, and like 300 people said, yeah, it could be done as an endowment fund. And then the next question was, if there's an endowment fund, should a citizen advisory group? And like 350 people said yes to that. So it was just a matter, people might have said no to the endowment fund, but they said if there's an endowment fund, you should have a participant citizen advisory committee. As we said, there was hundreds of recommendations from the public on how to utilize the funds, which are part of the report. There were some very serious, very good recommendations. There were some that were a little different. We had a request for an ice rink so that we could compete with, youth hockey in Harrisburg because they have the Bears around. Probably the one that we liked the most, but I'm not sure we could get it through. It was a ballistic military helicopter for the county. I don't know if there was concepts of bombing Dauphin County and Perry County. I'm not sure, but that was one of the recommendations.
They were interesting.
Public comment, you get some of those.
And they're all contained in the appendix. So
Yes,
you can
you'll
see
see them.
the various.
The feedback from the survey was used by the committee to make the recommendations in our final report to you.
So as Randy said, during the survey and even from the beginning, the committee was asked to look at the concept of an endowment fund. So a lot of the meetings we did discuss creation of one. And this is what we came up with a proposal, and I'll let Lou discuss that further.
There was a strong feeling on the part of the committee, as well as everyone has noted, that the public, that there should be some long-term way to maximize this money, not maximize its lifetime, as well as maximize its impact. And it would allow us over a long period of time to address a lot of these unfunded needs that the various staff people outlined for us. kind of give you an overview of what the concepts we were thinking about for the endowment committee. As I say, maximize the need and the impact and the reach of the 7.4 million target unfunded needs, especially for older persons, in keeping with the source of the funding, although allow for other areas also, and assure meaningful community input and transparency. That's basically referring to the Citizens Advisory Committee. The application process, we wanted to keep that as simple as possible, realizing, of course, that you do need to make sure that you're getting a valid and a needed program that you're going to fund, and that no funding from this would supplant any existing funding, but it could be used to supplement where funds run out or there are special areas that aren't covered. We did want to prioritize funding, although not exclusively, for people 62 years old and older, or older people, however you prefer to define that. We noted 62 and older. And we also felt that an annual report to the public would be a very appropriate way to not only let them know what was done and the hard work that went into this and the good that was done, but also to encourage people to give comments for future. People who have needs that may not have been identified. This was really, we worked 6 months. And as you know, the county's issues are very, very broad. So whether there would be new things and as times change and funding changes, there would be other things. So encouraging that transparency and the input of the community, we felt was very important.
Thank you. So in conclusion, I have 4 points here, but I do want to say one to the committee members. It has been a pleasure and an honor serving as the chairman, and I appreciated all their support during all the meetings for the last 6 months. And I do have to do a special shout out to Stacy Snyder. She was a big help, not only to myself, but all the members of the committee. Having worked in local, state, and federal government for over 30 years, it's when you put a committee this size together, it is sometimes like herding cats. But she was very good at keeping us on focus and on track. So a shout out to her.
And keeping the county out of trouble.
Probably, yeah. There were a lot of questions that we sent back to your solicitor. I do want to say that the members of the committee did take their charge with sincerity and seriousness. There was a lot of discussion, a lot of questioning of county staff about the different issues and how it works and how it could work better for the citizens of this county. We're grateful again to the dedicated staff in the county. They were tremendous. I can't say enough. They were always available when we needed them. You could email them even when there wasn't a meeting to make sure that there was information at the next meeting for the whole committee. The hundreds of citizens, like I said, 403 responses to that survey, which is phenomenal, particularly when it was only a couple of weeks out there. Not only that, but to get 187 people who actually provided a comment, no matter what that comment was, is also a tremendous endeavor. And finally, and I'll give credit to Rick for this one, it is our fervent hope that just as Claremont served multiple generations of Cumberland County residents in the past, so might the recommendations serve many generations of the county residents in the years to come. With that, if there are any questions. I'm going to close the computer if that's okay before I do something.
I'll take.
I sometimes am technologically challenged.
Larry, I want to thank you and everyone for, giving up your time to do this and looking through everything. You really hit, in my opinion, all the important pieces of this. So thank you very much.
Thank you for the opportunity. It really was a very positive process.
Yeah.
Good.
This is a tremendous amount of work. Thank you. And thank you for your openness to our county employees and our subject matter experts, because they know their jobs inside and out, and certainly can identify where we have gaps, gaps in core transitional services, right?
If I may, adding on to Lou's comments about an annual report, I think not only does it let the citizens know what's being done, but I also think it's a marketing tool to get people to consider donating to the fund. When they see that the money is being put to good use, and they're also hearing about additional or expanded needs, that certainly could be an incentive for them to say, maybe I want part of my legacy to be part of this endowment to support the county where I worked and lived and benefited from over the years. So there's multiple benefits from continuing to communicate about Claremont and the proceeds and what it's been doing.
There's that long pause.
Wondering, Stacy, I'm sorry, do we anticipate what our next steps are?
I have this slated as a follow-up on the Human Services Policy Team meeting next week, for you to hear from all of these subject matter experts. And then I would envision from there, there would be some direction on how you would like us to proceed.
Okay, thank you.
When is that, Stacy? The Human Services Policy Team is
Next Tuesday at 2.
okay. Great. Thank
Okay.
you. No other questions? Thank you all.
Good, thank you.
Thank you.
Thank you.
Michelle was mine.
Oh, hello. Nice. Tell her I said hello, thanks.
Thank you.
Okay, we have two other items, topics of discussion for today's meeting. The first is the grant program P25 radio funding agreement letter. Agenda items that just keep coming back. So Stacy and Bob, you have some additional information for us on.
You want to start, or you want to start? Where's the letter? Okay. As a follow-up to the award letter that was approved last week, they were sent out earlier this week to all the agencies. And this would be the formal agreement letter that will be executed once we get to the contractual side. This was reviewed by the solicitor, and I believe we're ready to go. It outlines for both vendors the process, and it will be the formal agreement with the agency once we get to what they order and the official allocation amount based on what they order.
I just have one comment on it. I think it's really fantastic. The final bullet points that says your agency or municipality fully understands, acknowledges, and I think agrees should be agrees.
We'll go ahead and fix that.
Thanks.
Work this out
Thank you.
once approved.
Yeah, I think you have hit every possible thing to hit on this. Well done.
Thank you. It's certainly a collective effort.
Yeah, really well done. It's excellent.
Okay, any further questions on that? Not entertain motion.
I will move to approve the Cumberland County Grant Program P25 radio funding agreement letter. With the discussed typographical correction.
I'll second that.
Okay, it's moved and seconded. No further questions. All in favor indicate by saying aye.
Aye.
Please record me as a no. All right, and that moves us on to the third discussion item, which is the execution of the grant program for the P25 funding letter, agreement letter as discussed.
So this agenda item refers to, much like we did it with CARES Act, where the signed, in this instance, the countersigned agreement letters when returned, they would be deemed fully executed if you move forward with this agenda item, rather than having them come back forward one at a time or a handful at a time to be approved.
Okay.
Yeah, I'll move to authorize the execution of the Cumberland County Grant Program P25 funding agreement letter as discussed.
I'll second.
Okay, it's moved and seconded. Any further questions? All in favor indicate by saying aye.
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 Ms. Oakley?
I have a follow-up question to discussion and approval on item number 2. Since Commissioner Eichelberger has voted no, will your signature be removed from this letter?
It should be, yeah.
Yeah, thank you.
Okay, any additional questions? Go on to item 5, other business. Anything additional?
Yeah, I just have a follow-up to the first item, the nursing home proceeds report recommendations. After the Human Services Policy meeting, which is next Tuesday, you are looking, assuming for the board to take some type of action shortly thereafter,
Whatever the timeframe you.
whatever the board wants. Okay. That's it. Thank you.
Okay, anything additional? I'd like to ask for a brief executive session after the meeting. So if there's nothing additional, entertain a motion to adjourn.
Move to adjourn.
Stand